Good morning, everyone. Welcome back. Happy Monday. All right, let's see. Get started here. Ava, would you please give Spanish language instruction in Spanish?
Si necesitan interpretación, por favor, vete a la página de tu caja de herramientas. De ahí vas a ver un globo o puede ser que ves en la caja de herramientas las letras ESP. Marca ESP o el globo, activa la sección de interpretación. Si tienes alguna pregunta o complicación, por favor, éntralo en la cajita chat. Izzy, back to you.
Thank you. All right, you should see language interpretation available at the bottom of your screen. You can click the globe to begin, and then you choose either English or Spanish. Let me turn the captions on. You can also, excuse me, you can change the caption language to the language that you prefer as well. Let me see here, make sure I got everything right. There's always a lot of little things to start before we actually begin. But I think I've got everything working and going now. All right. Welcome to Early Care Connection. I'm Izzy Greenberg. Today we are joined by our usual panel of experts, Meryl Gay from the Connecticut Early Childhood Alliance and Ava Bermudez-Zimmerman from the Child Care for Connecticut's Future Coalition. Ava will be standing in for Sandra, providing interpretation for us this morning. So she will be on the interpretation line, but not speaking live in English or both languages this morning. So thank you, Ava, for providing interpretation this morning. Reminder to our guests to speak slowly for our interpreter. Also, for everyone who's here, you can use the chat for communication with the community or for any technical difficulties you may be having, but please use the Q&A for any questions for our guests. All right, just a reminder that this is our last webinar for July, that we will take off July 15th through August 12th for a small summer recess, about 1 month. But if you don't mind, please keep this on your calendar, because if there is any new and exciting development, something you need to know about, we'd like to reserve the right to have a last minute change in calendar. So keep this on your calendar, but don't plan on it. And I hope everyone is able to take a little bit of rest this summer as well. We'll all be working, but not doing these calls. So, all right, so we've got some interesting stuff today, as usual. We're going to be doing a little bit of a legislative look back. So some updates you haven't received from this session, and a little bit of information from last year's session as well, to see where things stand with some legislation that passed in the 2023 session. So we're going to start out this morning with Luis Luna, who is the coalition manager for the Husky for Immigrants Coalition. And he's going to be mostly telling us about the recent expansion of Husky for undocumented children up to age 15 and some other updates. So I'll pass it to you, Luis, to update everybody on the work you've been doing.
Hi, thank you so much, Izzy. So good morning, everyone. My name is Luis Luna, and I am the coalition manager for Husky for Immigrants Coalition. So our coalition is a coalition of organizations that is getting together to fight so we can expand Medicaid benefits to all immigrants, regardless of immigration status. And just to zoom out a little bit, so in Connecticut, there's about 113,000 undocumented people in the state. Now, about 60% of those who are undocumented don't have access to health insurance. That is Medicaid, Medicare, or the ACA. So that's where our campaign this is where a campaign comes in. We have built a campaign that is fighting to expand Medicaid benefits. Now, something really important to remember is that the rules for Medicaid are written by the states. Therefore, the states or the legislature, they determine who qualifies, what are the income requirements, and what is covered under Medicaid or HUSKY. So over the last 5 years, we have been able to win opening the Medicaid program to undocumented children up to the age 15. And the new implementation up to age 15 started in July 1st of this month. Now, in Connecticut, so far there's about 12,000 undocumented children who have signed up to age 12. And I don't want to confuse too much folks with the dates, but as of July 1st, any children who qualifies by income is able to get Medicaid benefits. So yeah, so I'll leave it there just in case folks have any questions, and then I can just go to the next part.
I'm gonna, I think, yeah, I don't see any questions in the Q&A right now, so you can continue.
Thank you. Yeah, so we see the campaign as something really important for our families, as I mentioned before. When you have about 60% of undocumented people who don't have access to healthcare, it means that folks are delaying care. It means that folks are seeing or are feeling medical conditions, and we are not seeing the doctor because we understand as undocumented people that costs are expensive. Now, also important to note is that the community health centers that are all over the state, they do accept patients. Most of the community health centers have a sliding scale. So if you do need to see a primary doctor, I encourage you to visit this community health center so they can at least look at you through a primary care through a primary care. What's really also been very exciting about this campaign too is that as a campaign we have been able to share stories. We see how difficult it is for young people to not have health insurance, for young adults to older adults to not have health insurance. And I think the opportunity here, as I mentioned before, is that the rules of Medicaid are written by the states. Therefore, we can get together to build a comprehensive campaign where we can actually rewrite the rules. And is that something that is beyond beyond reality? I think that if what this campaign has proven is that we can get together, strategize, work together, and then make sure that we pass legislation. Lastly, I think like one thing that I wanted to also make a big point here too is that we believe that healthcare is a human right. Therefore, our campaign's objective in the long term is to make sure that everyone has access to insurance through Medicaid. And that is what drives the campaign forward. It's what sort of like is what we see as like as our long term vision, and we are making that progress slowly and incrementally, and we have been able to sort of like change the conversation. So I'll stop there to see if there's any questions, and I can speak a little bit about how does one access Medicaid. So if there's no questions, I can go ahead and.
You can keep going. I think one thing I would just insert is that I was really, of course we think about these things, but I was really struck, certainly during the pandemic, by how much everyone's healthcare mattered for everyone. That one individual not receiving healthcare doesn't just affect that individual or that family, but really affects the whole community. And so I think having everyone have access to some primary care, some healthcare, even just COVID tests or medications, certainly thinking back a year or two, So this is good news. Okay, you go ahead and proceed. There aren't any questions yet.
Thank you, and I think you're making a really good point here because you know, as childcare providers, you know, if we as childcare providers, if we're not able to take care of ourselves because we don't have access to health insurance, you know, how are we going to take care of our children? And at the same time too, like, you know, when children are not able to access healthcare, you know, how does that play into the larger family? So yeah, so that's a really important important point. So sh- uh, uh, Izzy, if you could share the screen, the only way, or like there's two ways that someone can register for this program.
Hold
One
on.
of
You want me to allow you to share screen, or you want me to share with
yeah, if you
the
can share the
income
if you can
guidelines?
yeah, if you can share the income guidelines, I can just kind of
Yes,
walk folks through that.
I can.
And we will send, we're working on some easier to read documents that we'll send out that I'll share with folks who organize this, and then they'll get that to you. And let me
I'm
know.
just trying to get it in the right spot here.
Sure.
Because it's wide. All right. Okay.
Thank you so much.
So try to
Yeah,
make this
so
bigger.
thank you. So as a reminder, yeah, Medicaid or HUSKY is a program for low-income families. So this table shows the income that a family needs to make in order to qualify. So this is below. So if we look at the family of two, on the top right part of the where the pointer is, if there's a family of two, you have to make a monthly income below 2,726 to qualify. If you have a family of three, 3,443, so on and so forth. So if your family's income is below what is there, then your child 0 to 15 can qualify for the program. So yeah, so you'll see like and the Husky and this is like for the whole Husky program. So when we send the information to you all, we'll have only what it relates to 0 to 15. So, you know, I don't want to confuse anyone here. Now, on the chat, I put a number for folks to call. So the number that a caregiver or a guardian or a parent, it's the numbers on the chat is 1-855-805-4325, and I just put it on the chat. Unfortunately, you are not able to do this online. This program you can only call. Yeah, so like you have to call the number, and sometimes the waiting time on the phone is long. So just heads up on that. So if you call and you know you're not able to speak to someone, you know, I encourage you to just kind of try again and until you find someone. It is not a perfect system. I do have to recognize that, but we have been working very closely with the Department of Social Services, and they are doing their best to make sure that folks are able to register to the program. With that said, I think the program has been quite successful since the implementation of the first phase of the program in January 1st, 2023. Over 12,000 kids have signed up, which is amazing. It's a really, really amazing thing that that this door has opened to so many children, thousands and thousands of children across the state. So we'll send more information. So yeah, so a couple key takeaways. I'm gonna just repeat them. The new implementation date started on July 1st, so that's up to 15 years of age. And the number to call within the income requirements is the one that I put on the chat. So it's 1-855-085-4323 4325. We'll send more information just so you have that with you. And also, I forgot to mention too that that this also includes prenatal and postpartum care for pregnant undocumented individuals. So if you know anyone who is undocumented who's pregnant, they as soon as the person knows that they are pregnant, they will get the full gamut, the full benefits of Husky. And then pregnant people will get a 1 year postpartum comprehensive care under Husky. So that's also another benefit that the campaign has also pushed for. So that's that. I appreciate everyone. If you do have any questions, do let me know. I'm here to answer if I have the answer.
Okay, so there's some questions. Well, first, there's a few comments in the chat just saying that this is so important for providers to have medical services because many don't have benefits, and as this community knows, a lot of providers are making very low income wages, and so that's just one comment. There's a few other questions here. Do you have to have been in America for a certain amount of time to access these benefits?
That's a good question. So no, as long as you're a resident, if you live here, and you have access to this, or the child
I guess
has.
that actually it's America or Connecticut. I guess it's both of those. Yes.
Yeah. So you have to be, a Connecticut resident. And you have to be a Connecticut resident, and you prove that by, maybe if you have a contracting for your apartment, or you have a bill or whatever, you call, they qualify you, and then you send those documents that they require.
Ava
Work,
is saying there used to be a 5-year rule, and she was
yeah.
wondering if that is waived.
Yeah, exactly. Yeah. So if you are a resident, if you are a permanent resident, then you cannot access Husky until after 5 years. But if you're an undocumented person who's pregnant, or an undocumented child, 0 to 15, there's, so long as you are a resident.
Okay, so
That's
this is for these very specific categories. Okay.
correct. Yeah, correct.
And is there anything available for youth over age 15, so 15 to 18?
Yeah, so there's nothing available. However, I think that if you live close to a community health center like Fairhaven Community Health Center, or Hill Health Center, or any other community health centers, I do encourage folks to visit these centers if you need any primary care, because they do have an open door. I do have to acknowledge that navigating the healthcare system is difficult, and sometimes you might run into obstacles while accessing care. So I think that the so just wanted to mention that, like, because of we have heard from folks that sometimes they go to the community health centers and they might get denied care, but um, I just encourage to continue to try if that is the case. And it's the reality for undocumented people, right? Because undocumented people don't have access to this insurance program, so it's difficult. But I think that there's a lot of resources and a lot of folks who work with us, including the Early Care Connecticut and the Coalition for Early Childhood, and anyone like that you can reach out to, and they might have some solutions for some things.
That's great. We also have a question. This is an adult provider who lives in Hartford, who has not had health insurance for the last 4 months, pays for it on her own, and has had many problems getting Connecticut insurance. And she's wondering if this phone number that you shared is also good for adults who might need to access health insurance but are having a hard time.
Great question, and the answer is yes. So and when you call this number, they have created a new system to channel the questions. So like yeah, so that's the number that, yeah, in short, yes. So you call the number and then they'll have answers for you.
Great, thank you. Luis, that's it for the questions we have here.
Awesome.
Anything? Oh, wait, school-based
Yep.
health centers. Oh, I'm sorry, Meryl, did you have your hand up? I missed it. Eileen is also sharing that school-based health centers are a great resource for older children, whoever had asked that question. And they are in many high schools across the state. And so to look for that. That
Yeah,
doesn't help
indeed.
every child in the state, but it does help some. Meryl, go ahead.
So my question is less about what it does and more about how you won. What would you say are the key factors in winning this?
Yeah, I love that. Meryl, that's a great question. That's a really great question. So 5 years ago, the conversation was much different, right? So it was like the conversation 5 years ago was who deserves healthcare rather than everyone deserves healthcare. So we were able to notice that. And I think like the first battle was the ideological battle, right? Like sort of like thinking, like pushing the message that healthcare is a human right to the point where everyone was like, I agree with that. That makes sense. Healthcare is a human right. So that was like part one of the of the battle, you know, how we won, how we were able to win this. The second part was like this complicated legislative campaign where we have to engage with legislators. We have to engage with community members. We have to engage with medical providers. And also we had to ground ourselves in research. So then when legislators were like, hey, how much is this going to cost? We can say, here is how much this is going to cost. Here is, here's like facts that are here are facts about our campaign. So yeah, so I would say like it was like two things. Like one, changing the conversation, um, grounding ourselves in healthcare as a human right, and then also building a comprehensive campaign that is pushing all of these angles.
Yeah, I think the childcare folks are in that first part of, childcare is essential. And we're still waging that battle. We're in that first phase, but it's great to hear how you proceeded from that. Meryl.
I was just going to say, tactically, from a perspective of the campaign, what did you think worked? What were, like as we work on trying to expand childcare eligibility, what do you think were the things that sort of lessons learned from your campaign?
Thank you. That's also that's also a really good question. Let me think about it. Could you repeat the question again?
Also, what things worked best in pushing this with legislators and mobilizing the community of folks who were impacted by it?
Thank you. So one of the big questions that we had is how much is this going to cost the state? So like if we were to expand from like 0 to 18, how much will it cost? If we were going to expand it beyond that, how much will it cost? Some questions arose too about like what are the savings that the state will have? So if you look at preventative care, we know that preventative care is cheaper. So then looking at those numbers. So earlier in the campaign, we saw that because we had a lot of questions from legislators. Again, how much is it going to cost? How much are the savings? What are the what are other like economic incentives that this law will bring? Therefore, we got together. We wrote a grant we wrote a grant to have a study, a full study, under the Rand Corporation that will give us some of these numbers. So I just put on the chat just the facts that we use with legislators, because they would often ask, hey, how much is this going to cost? And some other numbers that we were able to share with them. And then we will say, hey, look at this data, look at this other data, etc. So we put this together. So when so that I guess like that's like my short answer is like, the cost and benefit was a big question that we were able to find and present to legislators.
It seems to me that it could be maybe not as much in Connecticut, but it certainly could be politically divisive to suggest that everyone should have health care. But I think that, and I understand, I sort of understand the mentality on all sides of that. Not to say that I agree with all sides of it, but I understand it. But to say, you know, our state saves money, I think people can be won over by, even if they aren't won over by the human element, they're often won over by the economic element of, oh, our state pays more money when we don't take care of everyone. Or when we, you know, it goes for really so many different, when we don't educate everyone, when we don't provide quality care for everyone. And so I understand that that tactic also seems, I think the financial tactic can sway people who might not have been swayed by the human element. So I think that's really smart, and I appreciate your fact sheet. Meryl, did you have follow-up questions?
I think that's it, except, well, the question of mobilizing the folks who were impacted by this to be advocates, and what were the things that you found were most successful in doing that?
Yeah, thank you. That's another great question. So we are super grateful that we have really good champions behind us. So Senator Looney has been like central to our win, as well as the chairs of Human Services, Senator Lesser and Representative Gilchrist. So they have been great champions. So because we had them on our side, we anticipated that we will have a public hearing. So therefore, we organized with our organizations to say, hey, down 3 months is going there will be a public hearing. So we need to make sure that people sign up and that people tell their stories. So by having a few months to prep, it gave people the chance to really look at the members of their organizations and really think about, like, you know, what are the strongest or what are the stories that can tell this issue like more clearly, etc. So therefore we coalesced everyone around these high peaks of the legislative process, right? So we have like the launch, we have like the public hearing, then we have like, you know, lobbying days, etc. So knowing that that's coming, because it will come in a legislative session, we know that these things are going to happen, are giving us enough time for us to let folks know about what's happening and to mobilize. We also use that tactic as well.
Great. One more question has come in. Do you need to wait until November for open enrollment, or can you enroll at any time?
Great question. So you can for Husky, you can enroll anytime.
Great. All right. I think that's it for all of these. Thank you so much for sharing your tactics, your strategy, and your success with us. And congratulations on your win. And we will, I'm sure, be hearing more about this at some point. Thank you so much, Luis.
Thank you so much, everyone. So good to be here. Thank you.
Great. All right. So next up, we have Maddie Granado, who is with us. She's the Government and Community Relations Manager for the Connecticut Paid Leave Authority, and was really instrumental in having paid leave passed in the state. And so welcome to you, Maddie.
Great. Thank you so much, Izzy. And good morning, everyone. Can you hear me okay? My internet is
great.
Like spotty this morning. Classic. So okay, I'm just going to share my screen. You can see my screen good?
See it, yeah.
Okay. Great. So good morning, everyone. I'm Maddie Granado. I'm the Government and Community Relations Manager for the Connecticut Paid Leave Authority. And I'm here just to provide a really brief update on Public Act 24.5 and Act concerning changes to the paid family medical leave statutes. So by now, I believe everyone is pretty familiar with Connecticut paid leave, especially if, you know, a lot of providers and employers on this call this morning. So, but just as a refresher, the Connecticut Paid Leave Act was signed into law by Governor Lamont in 2019. It creates a source of income replacement benefits for eligible workers who need to take time away from their jobs for a qualifying health or family reason. So here's just a quick snapshot of how Connecticut Paid Leave works. The program is entirely employee funded. Covered employers right now are deducting 0.5% from their workers' paychecks. These are called contributions. Employers remit these contributions quarterly to the Connecticut Paid Leave Authority. Contributions are pooled into the Paid Leave Trust Fund. And our program sort of works like insurance, right? Where a worker will apply to the Connecticut Paid Leave Authority for income replacement benefits while they're away from work to care for themselves, care for a loved one, welcome a child, along with a few other related reasons. When a worker needs to take time away from work for a qualifying reason, they'll then apply to their employer for job protected leave under FMLA. So Connecticut Paid Leave provides income replacement benefits, while FMLA, or the Family and Medical Leave Act, provides a job protection. That's like an important distinction between the two. So since Connecticut Paid Leave took effect on January 1st, 2022, so about 2.5-ish years ago, we've provided more than $750 million in income replacement benefits to over 113,000 workers in our state. The majority of paid leave claims right now are for a worker's own serious health condition, and claims have come from every city and town in our state, as you can see through the map that I have here that we update regularly. It shows how many people are using paid leave per town per 10,000 residents. Also, I apologize if you hear my dog snoring in the background. She's really loud. I can't control it. I don't know.
We've all been there.
Oh, it's brutal.
Don't worry, we don't hear her.
Okay, thanks. So I'm here to just quickly provide an update on the authority's legislative priority from this past session and act concerning changes to the paid family medical leave statutes. The law passed the Senate and the House with pretty broad bipartisan support, and it makes technical changes to the Connecticut Paid Leave Act that enable the authority to make important process improvements to how we do our work. The law is effective on October 1st, 2024. So here are just a few components that may be of interest to child care providers and advocates who are on this call. First, the law revises the Connecticut Family Violence Leave Act to include victims of sexual assault. This means that victims of sexual assault can apply to Connecticut Paid Leave for income replacement benefits for up to 12 days for reasons listed under the Connecticut Family Violence Leave Act. So that includes if a worker is a victim of sexual assault or family violence and needs to seek support from a victim services organization, if they need to relocate or attend a court hearing, et cetera, or receive psychological or physical care, they can apply to Connecticut Paid Leave for up to 12 days of income replacement benefits. The law also establishes a procedure for tribes to participate in Connecticut Paid Leave. The Connecticut Paid Leave Act was originally silent on whether or not tribes can participate in our program, so there was really no way for their workers to be covered. So the law that was passed this session establishes the procedure for tribes to participate through entering an MOU with the governor that will allow them to participate in Connecticut Paid Leave and receive income replacement benefits when they're eligible. This is somewhat related to childcare, not really, but just as a person living in our state who goes to the doctor, something to be aware of is that the law also requires healthcare providers to display Connecticut Paid Leave information in areas that are accessible to patients. So just something to keep an eye out for. As of October 1st of this year, all healthcare providers are required to have some sort of information about Connecticut Paid Leave in their waiting rooms, in their visiting rooms, et cetera. So here are a few additional components of the law that passed. Again, the law makes pretty technical changes to our program. It doesn't add new responsibilities on employers, but in case you're interested, here's just a few extra points. The law clarifies the definition of municipality in Connecticut Paid Leave and Connecticut FMLA. The original law, under the original law, your only municipalities are only considered covered employers if they're employees who can collectively bargain to participate. But there was no clear definition of what a municipality is, so we tried to clear that up in the law this year. It also makes explicit what employers' responsibilities are with our program. They're responsible for registering with the Connecticut Paid Leave Authority, remitting contributions, and submitting payment return files. Again, that's something that's already happening in practice. It just wasn't really clear in our existing law, so we tried to really clear that up. The law also allows the authority to charge interest if an individual doesn't pay a penalty or repay an overpayment in a timely manner. It changes the date of Connecticut Paid Leave's annual report from July 1st to September 1st. So if you're interested, keep an eye out on our website. We'll have our annual report published by September 1st of this year. It also clarifies what other state or federal benefits will not require denial of Connecticut Paid Leave if they are received concurrently. Again, this is something that we're already doing in practice, but wanted to clear up in the law. So I'm also just sharing some upcoming events with Connecticut Paid Leave. If you're interested specifically in the new language passed in Public Act 24.5 around the definition of municipality that I mentioned, we are hosting a webinar with CCM on Thursday, August 15th from 1 to 2 p.m. on Zoom. I can share the link to register in the chat. Again, that's specifically regarding the definition of municipality and what it means for entities that are affected by that, in towns and city government. You can also feel free to stop by the Connecticut Paid Leave table at several events across the state over the next few months. Notably, we'll be at Hartford Latino Fest at Dunkin' Donuts Park on July 20th. We'll also be at New London Pride on August 10th. And again, we have a full calendar of events on our website that I can put in the chat. We are also always happy to do a webinar or an event or a table at an event that you're hosting in your community. Just feel free to reach out to me. That's my email address, and I can also put it in the chat. We can do webinars in English and Spanish, and typically our webinars cover like the basics of our program, how to apply for benefits, how to know if you're eligible, etc. Great, and that's all
I shared the events calendar. Did you also want me to share that webinar link?
I don't know if folks on the call are interested, just in case I can copy and paste it.
Sure, I got it. Okay, great. All right, thank you, Meryl. I think you're. Did you have any questions? I don't see any questions from the community, but also, folks, this would be a good time to put them into the Q&A if you have questions.
No, I don't really have any questions.
I know we've learned a lot about paid leave. I feel like we're experts now. I love it. Okay, so there's your Maddie's email. Thank you so much. And I know we have also, I think those same questions, you know, about how your campaign kind of made it happen. We've gone over before, but I think, you know, I'm just curious to hear if you have any just kind of like top level takeaways now that you're a little bit past it. You know, what was it similar to Louise? Because I think that, you know, folks who haven't heard this before may be interested to know.
Yeah, no, I really related, I think, to a lot of what Louise mentioned. Yeah, and I'm trying to think, but 2019 was feels like a long time ago. A lot of life between then and now. But
I know, the pandemic felt like 30 years.
Right, exactly. But no, I think really, you know, sticking together as a coalition was important to finally get across the finish line. Storytelling, especially important. Yeah, building your champions. We were always really grateful to have very strong champions in leadership and also in the labor committee, our co-chairs. So yeah, I'm happy to talk about that anytime. And I'm in a different role now, but so I see it from like a kind of a different angle.
Totally.
It's really interesting. So
yeah, it's good to go from one side to the other. I mean, listen, this is how it is with so many things. I think that the bottom line for some folks is wow, we really should be giving people the time and space to heal and to care for each other, to care for their family. And others might say, you know, no, that's a private matter. It's not up to the government. But they might be swayed by the economic savings. You know, I want my tax dollars to go towards, I want fewer tax dollars rather to go towards things than more tax dollars. And that could be swaying to people. I think certainly when we think about childcare, when we think about bonding, the necessity of the caregiver child bond, certainly in the early days after delivery of a child, you know, there's so many opportunities for, I want to say prevention. I mean, that's the prevention of difficulties later. You give time for that bonding and you save money on things later because that bonding didn't happen. And it's really hard to make that case when people don't understand the mechanics of that. But I know in this community, we see it all the time, how children that didn't have the ability to have time for a healthy bond end up with other things that then need to be, you know, helped and supported. So anyway.
Yeah, no, it's very, very true. And I'm
kind
very
of observation
grateful too
from
for
that.
No, of course. And you know, throughout the whole campaign, the Early Childhood Alliance was a really great ally. So we're really appreciative of that. So thank you.
Yeah. Thanks so much, Maddie. I don't think there are any questions. I mean, people do definitely know more about your the authority and also the campaign because we've gone over it before. But thank you so much for your time today and for the work that you're doing. And maybe just one last, okay, there's your email. Is there a phone number or a website that you want to share with folks?
Sure. The authority's website is just ctpaidleave.org. And we have actually a lot of really great resources on our website, and we're continuing to build a resource catalog for folks too that kind of takes into account the way people might retain information. So we have a new series actually that's coming out kind of gradually. It's called Paid Leave Spotlight. And if you have a specific question about the program or how things work, and you want just a quick video on it, that's what Paid Leave Spotlight is intended for. So I've really check it out. We work really hard to make sure our information is out there and accessible to people. So
yeah. Thank you. Thanks so much, Maddie. And thank you to Luis. Of course, as always, thank you to Ava for providing translation and Meryl for asking the questions everybody wants to know. I guess I would ask from the community that if there's any last things that you need to know before we take this month off, clarifications from this past legislative session, anything else, you can stick that in the chat right now. And just we'll take just 1 minute to make sure there's not anything kind of lingering before we're away for a couple of weeks. This would be a good time to do that. And I don't know, Meryl, if there's, I don't think, oh, Donna, nope, hand down. Okay, hold on, hand up. Okay, let's see. Hand down. I can't tell if somebody had a question or not, but I don't think so. Okay. We'll just give it 1 more minute. Meryl, I don't know if there was, I don't think you had any updates this morning, but is there anything else that you think people should hear about from this past legislative session that we haven't had a chance yet to go over before we take this little break?
Don't think so.
Okay, easy. I mean, it was a pretty short session and not on that.
Joanne's asking, when is the next call?
Thank you. Yes, I have. Oh, I didn't even see that Q&A came in. Oh, let me pull up my calendar here. The next call is going to be, we're taking, let's see, I have that. We're taking off through August 12th. So coming back the week after that, let me look at my calendar right now. August 19th. We'll be back August 19th. Oh, wait, Ava says August 26th. Okay. You're right. Okay. Apologies. August 26th. All right, everyone. Have a great month. As I said, please just hold the space on your calendar. I also am afraid that people will get out of the habit of being here on Mondays with us. So hold the space on your calendar, and we will reserve the right to host a call if needed, if anything urgent comes up. We won't bother you if it doesn't, though. All right, let me see. There's a couple of questions here. Will we get a calendar invite? We typically, I don't think you get calendar invites now, but you will get the usual emails that remind you that the call is happening. So Zoom, I think, sends an email. We will put something out on the ECE listserv. So if you're not a member of that, Meryl, do you have the link to join the ECE listserv? So you need that. Okay. Okay, great. I think that's it. Yeah, so Zoom will tell you, okay, we're starting up again, and also pay attention to the ECE listserv. All right, great. Meryl will put the link in to join that ECE listserv in just 1 minute when he gets it. Oh, you know, Meryl, I may have it if you're having a hard time accessing it.
I'm just trying to find it in here.
Okay. Well, if you can't, I'll see if I can. All right. Thanks, folks. Have a wonderful month off. I know it's not really a month off. Have a wonderful summer while we're not meeting. And I hope everyone's able to stay cool. This has been crazy weather. And we'll see you back here in about a month, the end of August. Thanks, everyone. I'm just going to keep this over. Oh, Maria's inviting people to a provider picnic, July 20th in Waterbury. And I'm just going to keep this open for another minute so Meryl can get that.
Yep.
Get that link for folks. So if you're waiting for it, stick around. If not,
there it is.
There it is. Perfect. Oh, is there an event link for the Maria? Is there an event link for the provider picnic? Or can you put in the chat how people would access information about that event, please? Yes. Meryl, it's saying there's an error on that page.
Okay.
How about we send, I was going to say we can, why don't we, Ava, is it possible to add the ECE listserv link in the next email out from Zoom? Why don't we start including that in that email so folks can also get that?
Yeah, I don't know if this link, let me try this one. See if that works.
Okay, let's see if this one works. Yep, that one worked. All right,
Okay.
that last one that Meryl just shared. Yep, it's very easy. I mean, you put your email. It's really easy to join, and you're going to get so much information. You'll be like, "Why did I join this?" But then you'll be like, "This is the greatest information." I get so many emails. I'm like, oh my gosh, but it really helps you understand what's happening in the whole early childhood world in Connecticut. So even if you're like, no, I don't need, to buy more furniture from your center, whatever. It's like, it's great. It's like, oh no, now I just learned that this center is closing in whatever town, or I learned that they've accessed, furniture somewhere else. So even the things that I think I don't need, I need. All right, I think we're done. All right, thanks. Oh, wait, is there something else? No, okay, we're good. I just hadn't cleared out the Q&A. All right, everyone, have a great week. Thanks so much.